Hello everyone and welcome to Lecture 4 of Ocular Allergies. In this lecture we're going to be looking at seasonal ocular allergies. Ocular allergies that occur in discrete periods of time during the year correspond to what you're exposed during that time of the year. Now, when we look at northeastern US and Canada, the tree pollen season typically starts March, April, May, followed by grass allergy season which peaks in June and July, followed by ragweed which peaks in August and September. Now, as decaying vegetation arises, mold spores and mold counts can also be measured, and they typically peak in late summer, early fall. With the first frost, it typically goes away. Now, when we look at ocular allergies, a person with year-round or perennial allergies can also have seasonal peaks during seasons if they happen to be allergic to that particular pollen in that season. Now, so someone with a dust mite allergy who has year-round allergies can also have a tree pollen allergy where their symptoms get worse consistently every spring. When we look for consistency, we typically refer to 3 consecutive seasons of symptoms. If I look at this as a pie graph, seasonal allergies accounts for the majority, about 4 out of 5 patients with allergies. The symptoms of ocular allergies can vary in intensity and severity. The most typical symptoms are itching and redness. Watering eyes is another common symptom, but more severe symptoms include lid swelling and chemosis, which is swelling of the eyes. So, when our eye is exposed to different pollens in the air, some of these pollens, if your body has a hypersensitivity reaction, will cause these symptoms. Because remember, your eye thinks it's battling some kind of parasite or something that's harmful to you, so it's trying to neutralize them. The more pollens there are, the more severe your symptoms typically are. Now, just to recap some of the symptoms. Not all of these symptoms necessarily need to occur, but in some patients, they will have coexisting rhinitis symptoms or nose symptoms. Approximately 4 out of 5 patients will have both ocular and nasal symptoms. Again, looking at northeastern US and Canada, east of the Rocky Mountains, the most prevalent seasonal allergy is actually ragweed allergy. Here is a close-up of the eye again. When a pollen irritates the mast cell, meaning it cross-links the Fc epsilon R1 bound IgE specific antibody, it will release the chemical warfare, meaning histamine, tryptase, and all the other jazz we talked about in the previous lecture. This in turn induces your body to have an early phase response, including epiphora or watery eyes, itching of the eyes or pruritus of the eyes, to try to neutralize the pathogen or what it thinks is a pathogen. Late phase responses occur approximately 8 to 24 hours after and sort of perpetuate the cycle. Cells communicate to one another in the immune system using what's called cytokines. This is akin to cells sending email to one another. Cytokines, there are many of them, are the chemical messengers of the immune system. Some of them will cause your blood vessels to become leaky, causing dilation. Others will cause mucus secretion and cell migration. Some other messengers, called chemokines, will actually attract other cells to the area of inflammation. It's kind of like, hey, I need a little help over here. Would you mind coming and helping to this area so that I can clear up this parasite? This will attract other cells to the area. These in conjunction perpetuate the symptoms of ocular allergies. Now, when a pollen sees the immune system, again, only when you have a hypersensitivity reaction will you get this response. Not everyone develops a hypersensitivity reaction because some patients correctly identify that this is something that's not harmful and your immune system learns to ignore it. Again, when we look at these symptoms, when things get severe, sometimes one can get burning eye symptoms or more severe symptoms like chemosis. When these symptoms occur, it can cause you to really rub your eyes or even become light sensitive, photosensitive. If you have any of these symptoms, I suggest you see an ophthalmologist or an allergist as soon as possible. Now, another common sign that's sometimes seen or noticed by doctors is the allergic shiner. This is darkening around the eyes caused by blood vessels being kind of congested and oozing out a little bit in the capillaries. This often corresponds to severe nasal symptoms that correspond to ocular symptoms. Here's a picture of a pollen. Again, this is something that is not typically harmful, so you really shouldn't be having these responses. That's why we call it a hypersensitivity reaction. When we look at tree pollen, a tree typically pollinates in the spring. It's usually the male version of the trees that are causing the pollens because they're trying to mate with the pollens and using air to carry their seeds across the wind. In the next chapter, we will focus on year-round or perennial allergies.